Hey team, so right now we're going to talk about ultrasound probe movement and how we move the ultrasound probe the right way. In the last session, you may have heard us say you need to slide the probe or sweep or rock or tilt, but what do all of those words mean? Well, a little bit of background. Why do we need to review ultrasound probe movements? Well, you have open psychomotor skills in which how the task is executed changes each time due to environmental forces. So, if you're driving a car, every time you drive a car is going to be a little bit different if you're on the highway, if you're on a backcountry road, if it's raining outside, or if there's a lot of wind, or like a surgery, if you will. Whereas a closed psychomotor skill, those skills are executed the same way each time and there's no variation. As you can imagine, ultrasound is a complex, open psychomotor skill. This doesn't even get into the indication about why you're doing the ultrasound. This is just how to actually do the ultrasound on different patients. So, how do we effectively teach the hands on performing of a complex, open psychomotor skill? The goal ultimately is to create long term memory with the skills we teach. Short term memory is your working memory. It's limited, you're unable to recall it 4 months, 6 months from now. This might have been the exam that you crammed for back in college on a class that you were never really going to use again. Your long term memory is when you can recall information. You have unlimited capacity of the long term memory, but it's riding a bike. We all can, even after years of maybe not riding a bike, we can all pick up a bike and start riding again, or maybe swimming. Might be a few examples of things that are now in your long term memory and that you just do. So, going a little bit further, we want to move things from our working or short term memory into our long term memory. Even motor skills like riding a bike, driving a car, or doing an ultrasound require this movement from working memory or short term memory into your long term memory. And so, with that, we need to make sure that we're talking and teaching at the right cognitive load. So, what is cognitive load? Cognitive load is the amount of information being processed in your working memory. If you have cognitive overload, it's too much information, too many tasks, and someone learning cannot process this information. The cognitive limit is the maximum amount a learner can process at one time, and that's going to be different for each person, but it's something to keep in mind. So why did I choose this picture? Everybody knows this particular song, 8675309. There was a really smart guy called George Miller who did a lot of research on how much information we can process or memorize at a time. Guess how much? Yep, 7 plus or minus 2 bits of information, like a phone number. It's also easier when it's broken into smaller chunks. Remembering a 4-digit code is going to be a lot easier than memorizing a 12-digit code. Cognitive load is broken down into schema, or how our brains organize information. Obviously, right here, totally disorganized. The ultimate goal is to have something completely organized that you can retrieve, know where it is, know how to retrieve it, and use that information accordingly. So, it's easier to learn a new skill if you have the foundation and prerequisite knowledge to build upon. Can you connect to something that you already know? This will help information move from short-term memory into long-term memory. If the foundational knowledge is missing, then this will become a rate-limiting step. Even with increased experience, missing foundational knowledge is missing foundational knowledge. Having this foundational knowledge and being able to adapt to an environment is critical when performing an open psychomotor skill. For example, we can teach you about some really cool advanced echocardiography findings, how to measure your MAPC and TAPC, and I know you're thinking, what on earth is she talking about right now? But if you don't have the basic foundational skills of assessing overall function and obtaining images such as an apical 4 view on your cardiac ultrasound, then being able to measure your MAPC and TAPC doesn't really do that much for you. Scaffolding is a variety of instructional techniques used to guide students to better understanding. So you need to start simple and build from there. Sequence skills to learn easy and high frequency skills before difficult or low frequency skills. So the teacher needs to adjust his or her level to help the learner's level of performance, or to teach to the levels learner of performance. One of the best analogies out there is from a guy named Keith Code. I'm not sure how many of you have heard of this guy, and honestly, I had never heard of him until I started getting into some of the nuances of teaching different psychomotor skills. But Keith Code was a bike racer and known as one of the best motorcycle instructors in the world. And he had a bike school, I think, out in California, which would teach, all sorts of really cool, crazy motorcycle skills, including a lot of stunt stuff. He founded the California Superbike School. So we'll think about motorcycle riding like we will performing an ultrasound, and that they're both complex, open psychomotor skills. So he said your learner has $10 worth of available brain space. Bear with me, guys. You need to budget this $10 really carefully. Early on, someone might have to spend all $10 on just getting the image, or whatever is the equivalent in motorcycle skills, like, stopping, starting. But you have no leftover change to think about image optimization or beyond. However, once you progress to another stage, then you may spend just $5 on image acquisition, and now you have $5 left over for image optimization. So pretty interesting stuff now that we're relating ultrasound to motorcycle racing and stunt performance. But bringing it back to ultrasound, that's just a little bit of background about why we're talking about this. So with ultrasound, we utilize the GOD principle. We want to, number one, get the views, because you have to get the views, and this image is everything. We need to be able to optimize the views and then document the views. Throughout this course, you will also learn how to start interpreting the images that you get. So breaking it down a little further, there is actually a language of transducer or ultrasound probe manipulation, and consistent terminology is key. So you can see here that we have a variety of different probe movements that we move around. And so when one of us says, now you slide the probe, you understand what we're talking about. See, everybody here is doing a slide, and we have one person who is unaware of exactly what that means. So they are just doing their own thing. But we really want everybody to be on the same page, doing the exact same performance. So when we say go forward 3 steps, backwards 3 steps, everybody does the same thing. So now we'll talk about the slide. Here we go. When we tell you to slide the ultrasound probe, we move it along the long axis of the probe across the body with a consistent angle of inclination at 90 degrees. So we're keeping the probe marker perpendicular to the skin and just moving it along the long axis of the probe. And that's the slide. Next is the rock. When we rock the ultrasound probe, we keep it at a fixed point, but change the angle of inclination along the long axis of the probe away from 90 degrees. Think of this movement like a rocking chair, if you will. Then we go on to the sweep. When we sweep the ultrasound probe, we move the probe across the body in the short axis of the probe. We keep the probe angle of inclination at 90 degrees, or the probe perpendicular to the skin. So now move the ultrasound probe across in the short axis of the probe, similar to the slide, but short axis of the probe for the sweep, long axis of the probe for the slide. And now we come to fanning. Fanning is when we keep the probe in a fixed position on the body, but move the probe by changing the angle of inclination away from 90 degrees along the short axis of the probe. I want you to think of a lady sitting on a porch in the Carolinas in the middle of August, fanning herself in the summer heat. The fan is similar to the rock, except the rock for the probe is on the long axis of the probe, and fanning is along the short axis of the probe. Next, we have pressure or compression. When we tell you to compress or apply pressure, we apply direct force on the patient's body with the probe. And finally, rotation. When we rotate the probe, we move the probe axis or compression axis in a counterclockwise or clockwise direction. So this is just you're rotating on that axis, holding the ultrasound probe in place, but rotating 90 degrees clockwise or counterclockwise, depending on what ultrasound exam you're performing. If you have any questions, please feel free to reach out to me. Here's my email address, and I will talk to y'all soon.